So when I went through the file you sent me, all the documents you sent me, you only had like one TPO antibody screen and not the other ones. So I was saying one of the things we want to do is check the Cyrix-Array-5 because that'll check, like do just a screen for autoantibodies, but also check gastrointestinal. So one of the reasons why you have gastrointestinal symptoms, you work with a lot of good practitioners, you've done a lot of implantation, you've gone through different protocols, you've done many things, and you still have persistent symptoms. So that's one possibility. The other possibility is it could be early Parkinsonism, which I know you don't want to hear, but since you have a family history with Parkinson's.
Don't say that. I don't want to hear that.
Now, let me tell you the main difference. So let's figure this out, because we have the GI issue, anxiety issues, memory, all these things we had to go through. Okay, right. Let's stick with the GI for a second. So, if I look at your paperwork you sent in, okay. So first of all, autoimmunity, we usually see symptoms of loss of tolerance. And you don't have a lot of, well, you do have some intestinal permeability, like unpredictable food reactions, aches and pains swelling throughout the body, unpredicted abdominal swelling, frequent bloating, distension. Those are all leaky gut symptoms. Constant skin outbreaks, intolerance to smells. There's a little bit of loss of tolerance. So you're kind of like on the border. So it's possible you may have some underlying autoimmunity, but then it's also possible that you may have some early neurodegenerative changes. So with early neurodegenerative changes, there's some findings that take place first. So with early Parkinson's, that happens 10, 20 years before you start to get any neurological manifestations. You can get gastrointestinal manifestations, but the chief one being, and let's make sure we're on the same page here, is slow intestinal motility and constipation.
Lifelong.
Yeah. You've added lifelong. Since you were 5, I know you were saying you had problems. Yeah. Okay. Do you think it's going to change in recent years in adulthood?
I take things for it now.
Take things for it.
So I don't suffer from it at all, but I take things.
Okay, but when you were 5 years old, you started to have gastrointestinal symptoms, right?
Right.
Do you remember if you had lots of infections when you were a kid, or were on lots of antibiotics?
Yes.
You were? Tell me more about that.
So when I was young, and I remember vividly up to like 7 years old when I lived in Iran.
Yeah.
I had lots of, mostly it was always mobility, constipated. I was always constipated. Then as I got older, I got a lot of ear infections and throat infections, and I had a really nice family doctor, but he was old school, and he ran me from probably when I was 11 years old.
Okay.
Or maybe even 11 actually. I was on antibiotics regularly.
Okay.
Until I left him at 17, where I decided I just was done with it.
Okay.
And then I had bladder infections, and then and it was always antibiotics.
Okay, so let's go back then. Let's dissect your timeline and figure out all the possibilities. Okay, so the microbiome fully develops by age 3, and antibiotic usage before that is suspected to cause lifelong gastrointestinal immune issues and allergies and sensitivities. That's one of the parts of microbiome development. So one of the possibilities is you just have a disturbed microbiome, because you've done lots of things to make a difference to your microbiome over the years, working with different types of healthcare professionals, taking numerous supplements. Like you probably have your own online, your home nutritional store in your pantry or something, right? At this point, do you have a whole room full of supplements?
My $10,000 worth of supplements.
Right. So there's something more. So it's not like you need the magic probiotic or you need digibenzyme. There's something that's more complex there. So this is where things get a little confusing, because it's unlikely at age 5 you would have autoimmunity develop without having more severe symptoms up until adulthood till now. And it's also unlikely that you would have any Parkinsonian susceptibility patterns, neurodegeneration patterns development at 5, right? So at age 40, 30, late 35, 40, which is you're in that age group now, that's where they start to show. So, but the key thing is you could have more than one mechanism, and we don't want to ignore that either. So if you've been on heavy antibiotic use, before age 3, And maybe throughout?
Not before 3.
Before, so after? So like age 5?
Yeah, it would probably like when I left in Iran, they didn't prescribe a lot of antibiotics. I don't remember going to the doctor a lot in Iran. I remember going for a vaccine here and there, but
okay.
I don't remember, and I only remember when I came to Canada.
Right. And you've had lots of, your recent GI panel looked pretty good, no major abnormalities, you had a SIBO test, that was all normal. Okay. Now, would you say, when you look at your symptoms, you obviously have feelings that you don't empty your bowel completely, okay? So another possibility that can also occur is there's lack of development in the enteric nervous system, the gut nervous system. So just like some people get developmental disorders, like ADD or autism or dyslexia or the type of things, there are now more and more reported patterns of understanding that some people's gastrointestinal nervous system never develops, and then they're now known as lifelong gastrointestinal compromised people. So we have to go back in your timeline. So that's a possibility, since you've had it since age 5.
Yeah, and I do know that my memory has not been good I've never had good memory.
Since you were a child?
Since I was pretty young on, my memory, I was the one who had to always do a lot more reading than most.
Because we look at your chief complaints, it's chronic gastrointestinal issues, anxiety, which is brain, forgetfulness, which is brain. So we really have brain-gut axis symptoms, right? Both of them could be part of the same thing. So when you were growing up, did you get diagnosed with anything like ADD or ADHD, or did you have any problems learning? Did you have any problems with focus, concentration?
Well, I was more playful in school. I did well in school, but I was I wanted out of school and I wanted to get into business. So I did my university, did everything, and succeeded. I did not fail. I didn't. Yeah. But I was very driven, and I've always been driven one way. Okay. So
no significant cognitive or developmental issues.
Not that I'm aware.
That you were, if you went to college and had no problem and everything, and no problems. No, so you're good. Okay. So let's keep thinking through all the possibilities here, working through them. Let me ask you a question with your gastrointestinal symptoms. The main symptom this whole time since you were 5 is just the bloating and discomfort, or is anything else?
I never had bloating.
Okay, so what was the first symptoms you had, age 5?
Just constipation.
Constipation.
Yeah.
Okay. And that lasted till this day? You have constipation?
Well, I don't know. I can't tell you as of now because for 5 years I take comp and magnesium and vitamin C mixed.
So you compensate. And if you don't take that, would you not have regular bowel movements?
If I miss it one day or whatever, no, I will have it.
Okay.
I don't know about longer than that.
So you never miss more than one day? You've been pretty consistent?
I'm very consistent.
Okay.
That's very important for me.
Okay. So go through the symptoms you had from age 5 to your childhood to now.
So childhood, I remember constipation and stomach aches.
Okay.
Always. I used to always have cramps. My tummy always hurt. I always had tummy cramps. They always thought I had worms. I did multitude of different worm, because in the Middle East that's very important.
So in Iran they were just thinking you had worms because was there any suspicion of a food sensitivity to milk or anything like that?
No. Okay. It was just always worms.
Always
you have worms.
Okay. And then they test you or just assume?
No, they do, and they give you things, and then you take it, and then the worms are supposed to come out, and that's we did that.
Did you ever remember worms coming out?
I don't remember as a child, but I do remember as of recent, maybe 4 years ago, I did a worm protocol again with Dr.
Doesn't matter the name. Yeah. And then the worms came out?
Yeah, I saw some things. He had told me what to look for, and I did it for I took this pill, I can't remember the name of it. But yeah, I saw things. Okay. Small things.
How long ago was that?
2018, 2019.
Okay.
And I have to say, in 2015, when I first started working with my first functional practitioner, I had reprieve for bloating for 2 years. And it was phenomenal.
And what were you doing?
I removed gluten and dairy completely out of my diet.
Okay.
So now I'm completely out of gluten.
But not dairy?
I am. But,
Doesn't sound convincing.
I love whipped cream.
Usually whipped cream is the entry dairy.
It's like sometimes when we go somewhere, just a little bit of whipped cream.
Okay. Well, it could honestly be as simple as that.
No.
Yeah.
Just that little bit?
Yeah. Yeah. So how many years have you been still introducing dairy now?
I haven't drank milk.
No, it doesn't matter, but whipped cream or dairy sources.
Whipped cream maybe once a month.
Once a month?
Once every
That doesn't sound right.
No. Truthfully,
I've been doing this for a while. I can tell. Facial expression, I can tell body language.
Okay. So previous to COVID, very rarely.
Okay.
Now, maybe a little bit more. Maybe once every, I would say, not weekly, once every 2 weeks.
Once every 2 weeks. Okay. That's all it takes. What about other food proteins? So have you tried being gluten free anytime recent? 100%?
Gluten 100%.
No, dairy. Okay, this could be case closed. As simple as that.
No.
Yeah. We'll
just a little bit of dairy is all. But I can have butter. I have butter.
Butter's different.
Okay.
But depends on if you have. So butter doesn't have casein, but a milk protein whipped cream does. And if you're not 100% like strict, you might not be even looking for hidden sources because you're just thinking about gluten.
Yeah.
And you could have had this since 5 years old till now. So here's the biggest thing. What is just screaming in your history as we talk is you had a window of time of an intervention that completely resolved your symptoms. And then it stopped, and the reoccurrence of a trigger.
But and I agree.
Okay.
And I think there was, 2 years I was wonderful. I also was very, I'm still a very clean eater, so I eat very clean. But I think for me also, sometimes I could be great. Recently, I don't know if this has to do with now when I don't eat dairy for like a month or 6 weeks, I don't have my whipped cream indulgence.
So let me just tell you something from experience. Usually, when someone's already giving to whipped cream, and they're not on a strict restriction, they're getting exposure.
And how long does the exposure
stay? It could be months.
Months?
Yeah. You can have an inflammatory response for 6 weeks, 7 weeks, 8 weeks.
You think all of this is because of that whipped cream?
Well, your continuous bloating and stomach discomfort since you were 5, that the first time it ever resolved was when you went gluten dairy free, and then everything came back and you're no longer dairy free. It sounds like really possible.
Okay.
Okay, so that's one of the things we have to put on the checklist. Okay.
Okay. Can I do any form of testing to know if I'm dairy?
Yes, we can do testing, but and we'll organize that, and we should definitely do that as we test for autoimmunity and other things. Okay, because we'll do it with Cyrex, we'll do both. But sometimes you just need to do a trial intervention. Okay, this becomes diagnostic for us, right? So what we really want to see is even irrespective of results, because labs aren't 100%, and the gold standard is still elimination and then provocation. So we really want to get you like 100%, like this, like your whole diagnosis matters.
So both gluten and dairy stay in your body for 6 weeks?
Well, an immune response to dietary protein can be many weeks. Wow. Yeah. So, and then there's other food proteins that could be similar to milk proteins that you keep ingesting.
Which could be what?
It could be other grains that are gluten-free grains. So there's some similarities between gluten and grains and milk proteins.
And what about things like alternative milks?
Those are okay.
Are you sure they don't cause any?
No, there's almond. You could have a specific, unique almond sensitivity or soy sensitivity. They don't cross-react with milk proteins. They're totally different proteins.
And even oat milk?
Oat milk is, again, its own unique independent protein, but it doesn't have similar. You could be independently sensitive to those, but we first want to see dairy like milk protein. Okay. And then remember, milk's not just in the whipped cream; it's in other sources. Like if you're not really careful reading everything,
right?
And sometimes a little cream in some products. Sometimes dairy is just, you won't even know it's in the food product until you read the label.
Right.
And you're looking for dairy, milk, protein, casein. Casein is, so there's different proteins for milk. Casein is one of them. Butyrophilin is another one. So, okay, I think your gut issue might just be that's
right. Time
okay.
to go home.
so best scenario is just that it's a milk sensitivity, and then if you go through the scale of worst scenario is like this is a motility issue, that this is like early Parkinsonian, and worst scenario in that end of the spectrum would be like there's an autoimmunity, right? So we'll check the whole spectrum and kind of see what it is. And you could have more than one. Like you could have milk sensitivity, which it clearly sounds from your timeline that you may have milk sensitivity, and some other symptoms that are there. But since the milk sensitivity is constantly making you feel bloated and uncomfortable, you don't notice the other ones. Right. So if we look at your gastrointestinal symptoms, so you put a few things on here. So let's go over these because these might not all be related to milk protein. So you put feeling that bowel does not empty completely, alternating constipation, diarrhea, and the thing that has me concerned is it may be more than one thing, because you're constantly having to use laxatives, right? Constantly. So that won't just be related to milk protein. This is where the neurological model comes in, right? Because the Parkinson's disease alpha-synuclein builds up in the gut, sometimes, like I say, 10, 20, even 30 years.
Yeah, I know
before
that.
And you may never develop Parkinson's to the point of you have tremor or stiffness or rigidity, but it could impact your gut. And you slow down the progression of it so it doesn't get past that. But now you have a chronic gut issue, and you have to constantly take things to help your motility.
Right.
So the key thing is, like, the most likely thing that going off milk will probably help you with your bloating and discomfort, but may not change your motility. So that's a whole different mechanism, right? So milk will cause inflammation and fermentation and all those things that will cause the bloating, but it may not change your motility. Now, sometimes it does, because sometimes the environment you change with your microbiome will impact things like methane and hydrogen, like you see with SIBO, but there's other bacteria, different gases that they release that sometimes slow down motility. So we're gonna like develop a strategy, right? Because the most important thing isn't another protocol or another list of supplements, because you already have your own nutrition, your own apothecary. What we need is a clinical strategy that we work together to figure this mechanism out, right? It's all about the mechanism. So the first mechanism is the possibility of continued dairy sensitivity, and we'll test you, but we also want to do trial and error. And then the other possibility, and that would be for the bloating. The other thing would just be the motility.
And how should we test that? Like myself, like I would just.
So it's gonna be
remove myself from all.
It's gonna be feeling like your bowels are completely empty. It's gonna be feel like you have to take your laxatives to have regular bowel movements. We may even have you stop taking them and see what happens as a way to evaluate what's going on with your intestinal tract. We're really going to be, for the first, I would guess, 2 or 3 months, just working through mechanisms together and trying to figure out the pattern.
Crossing off.
Because there's no point to treat something if we don't really know what's there. Okay, so there's a couple things that are going to be really important when we check you today, like rigidity, slowness, stiffness. Do you have any of those symptoms? Do you get tight muscle, like a tight shoulder, tight hip muscle all the time? Same one?
Back,
but how about just one leg?
One leg?
Yeah, like a tight hip flexor.
Yeah, just recently I've been getting my hip flexors. But
both or just one?
They tend to be both, but it's exercise too, could be, but more than ever I've noticed the hip flexors.
So one of the things you have to know, since you have a family history of Parkinson's, is when Parkinson's progresses, it'll actually cause stiffness in either one side of the body versus the other, not both. So the fact you're having bilateral hip tightness isn't as likely.
No, mine is usually bilateral.
Okay, but
I have to be careful.
But you need to know, even from this day on,
like
what to
this could be. Yeah.
So if you start to get, usually it'll be a stiff. It starts with the proximal joints, the ones next to your trunk, before it goes distal. So it doesn't necessarily, usually we'll start with a stiff shoulder, or for some people it'll be a writing cramp. Like when they start writing, they just cramp up all the time. And the hands gets really rigid and stiff. or it'll be in the feet like a restless leg, or their hip flexor. So it's kind of like either the very end of the hand, or the feet, or the shoulder, or the hip flexor, or the foot.
And what can you do if you, like, let's say today I'm here, maybe we don't know we have, I mean, you know, it's hard to diagnose anybody with Parkinson's, knowing that from my mom, but what can I do to prevent this?
Yeah, well, so that's another thing in your victory, because you actually also have early dementia symptoms. So we're going to check your cognitive function. So we're going to have to put together a brain protocol for you all together. Right now, we got to figure out what's going on with your gut, because it impacts so many systems. And you also wrote it down as your chief complaint.
Yeah.
Okay.
I came here because of that.
Because of your gut. That's the driving.
My gut is my driving, because it's just, I'm tired.
Wouldn't it be funny if what it is really just known for it?
Oh my God. That once every so often whipped cream that I indulge in. The only thing. Only thing I indulge in.
International flight and all this travel, hotel travel, labs, stop milk. We'll see. So we'll take a look at your intestinal motility, we'll take a look at your food sensitivity, and we'll take a look at your autoimmunity. Those are the most likely things.
But I am recently, and I mean recently from the time my mother got Parkinson's, and having done so much research about Parkinson's and knowing that it is hereditary, even though she didn't have anybody in her family that had it.
Yeah.
It has worried me.
Yep.
Because I'm very similar to her.
Yep.
She also had mobility, like stomach. She didn't have stomach pains or bloatingness, but she always had a hard time going.
Yep.
And we have very similar personalities, so I'm a bit concerned about that too.
Your risk is
high.
Significant.
Yeah.
So you want to adopt. Well, getting your gut healthy would be a good way to just help you head in the way of prevention, right? It's because you reduce inflammation. Okay. Do you ever have any issues with smell? I'm going to test your smell extensively today.
No, I have the best smell.
Okay. Tell me more about that.
I can smell
everything.
Everything.
Okay, so that's good.
Usually all bad and good.
Okay. I'm going to do some tests. So the other thing that happens is this early Parkinson's pattern starts with the gut and smell pathways. Okay,
but I have to tell you today, as of now, my smell may not be that good, because I was affected with COVID, and that was one of my...
Right, loss of smell. We'll check you. We'll just check you. How long ago was the infection?
About almost a month ago.
Almost.
But the doctors, I still haven't gotten my full scent back.
Okay.
Away, and the taste is still not 100% back.
Okay. Okay. So we'll have to consider that. All right. Let me go back to your GI symptoms here. Besides when you actually were gluten and dairy free, and had a first time window of feeling better.
Mm-hmm.
Was there anything else that made a big difference for you? Like when you had all these worms released from your body, how many, I can't tell you, just reading your history, how many times you treated candida, infections, all these things. Many times, right?
I've done so many protocols, and I never finished a protocol and thought,
that was it.
This is the thing.
Right. So I don't think like you have this mysterious, hidden, can't find, secret parasite no one can get to, or any of those things.
Right. I don't think so either.
Yeah. Okay. All right.
But the low white blood cells is a bit concerning, because we've tried to tackle them a few times with different doctors, practitioners, and we never could get to where we wanted to get to, because there was always this gut issue that we always said, okay, let me solve this, and then we can move on to the...
Well, we'll have to see. I mean, we'll get to the white blood cells for sure, because you also had on your lab, the only thing that was wrong with your recent GI lab test was your SIGA levels were a little bit low, which is your immune cell. Your gut immune system. Your good.
And I do have GERD too.
You do have some gastro.
Yeah. Okay. Because they did an endoscopy.
You don't have a lot of symptoms on the forms you filled out, but do you feel burning and?
Do you know? It's so funny. I didn't until I about short time before doing this endoscopy, which was in probably in late summer.
Okay.
I started to feel indigestion.
Okay.
So then I thought with my family doctor, maybe it's time to she recommended I do a colonoscopy and said, while you're there, why don't you do an endoscopy too? And I had no idea I had GERD. And then I came back, I had GERD.
Okay.
And I had polyps too. So they removed those. But the GERD, after that, I started to feel a lot of burning. So I started to take digestive. But I've stopped that now.
Do you remember if they tested you for H. pylori?
Yes.
And it was
mild.
Mild H. pylori?
Mild. It should have been in one of my tests, I think.
Okay. Let's look through.
The most recent with a doctor by the name.
Most recent should be towards the end. All your stuff blocked out. So this is the hormone stuff. Dynacare. Let me just start up here. Go back down.
It wouldn't be with Dynacare, I don't think. It was one.
Let me start with the. Let me start where this line is. Go halfway down the middle. This is your hormone profile. Right after that. This is your SIBO test, which is normal.
Okay. But somewhere in these...
Dynacare. Unavailable. No relevant growth. That's your blood count. So your blood test here. Probable IBS. Here we go. Okay, so rectin, gastric, GI junction, normal benign lymphoid, aggregate follicles, negative for dysplasia.
Negative for pylori.
Negative for organism resembling H. pylori. Okay, so you had a negative H. pylori test.
But then my functional doctor said I could have mild in one of the tests he did. But you don't think so. This is more they went in here.
Well, you can still miss it on biopsy.
Okay, so let's say I don't have it.
Well, let's say we check it out.
Okay.
Let's make sure you don't have it. Let's do a good test. Let's see if you have it. Okay. All right. So what else is going with the gastrointestinal tract? Bloating, distension, some reflux, motility issues.
I used to have a lot of stomach pains. I don't have it anymore.
Okay.
Like I used to have a lot, but not anymore.
Okay. So let's go back to the symptoms you have. Now, are there foods you know aggravate you? I know you don't.
Sometimes I'm confused because I don't know, like I'll eat something and I won't think there's anything in there because it didn't, but then all of a sudden I'll feel bloated.
Okay.
Like yesterday for breakfast I had eggs, I had avocado, I had bacon, and one piece of toast, with gluten-free toast with butter on it. Everything, that should have been a meal, that would have been like with jasmine tea. And what happened?
So you may be sensitive to butter too.
Oh God.
We'll have to see. So when we go dairy free, we got to do butter too.
No, don't do that. Really.
It's just for a short period of time.
Whipped cream and butter.
Well,
just
we'll see.
might as well
End it.
End it now.
Okay. All right. You're okay with fats? It seems like fat doesn't really bother you too much.
No.
Okay, so you don't know what causes bloating. It's just kind of random.
Because it happened. It's there. I don't have a lot of reprieve.
Okay.
So I'll have like maybe a few days, and it's not like I had whipped cream again.
Okay.
Right.
So for your GI tract, the plan is we're going to go dairy-free, including butter, for a period of time. Okay, that'll be like in the first phase. Then we're going to wait to get some testing back for the autoimmunity and H. pylori.
Okay.
And then we're going to do a thorough neurological exam for any early Parkinsonian patterns. And that should help figure out what's going on with your gut. Okay? and then we'll go through that process to see what's happening. By the time you get your lab test ordered and you get the results back, that'll be like on 3 weeks.
So I'll be dairy-free.
So you can be dairy-free for 3 weeks, and then I'll let us know what kind of impact that's having on you. It may not give you any symptoms, but it may. Because more than likely, if you're reacting to it, it'll give you bloating and discomfort. You still may have GERD because you may just even have an infection, or it may completely go away. We'll have to see how you respond. Okay. Now, the second chief complaint you have is anxiety.
Yeah.
Okay, so give me more detail about that.
Anxiety started in my late teens.
Okay.
Like 19.
Okay.
Very strangely, from a friend who suffered from anxiety, and me always being there supporting them through their anxiety. So I was always there, and like when they would have massive anxiety attacks, we had to leave somewhere, go into somewhere and breathe, lie down.
Oh, so it was anxiety attacks?
Yeah, severe. So I used to always be with them, so I was always supportive.
Okay.
I didn't know what anxiety was.
Right.
And then all of a sudden, like some time later, I started to suffer from anxiety. So I thought
anxiety attacks. Where your heart rate would go up and you can't breathe and
yeah, no, not so severe.
Not so severe.
Right.
Okay.
And
So what happened?
From reading, I just learned that maybe it's a learned behavior.
Okay.
Right. So I kind of put it aside. Then obviously I've always been proactive. I exercise a lot. I did yoga. I saw therapists. Like I always tried to. So then it kind of went away, and then it kind of comes back and goes recently, and I don't know, because other than the only thing I know that I do religiously now is I gag.
You gag?
Yeah, from listening to you. Like I gag every morning in the shower.
Oh, I mean you're gagging your exercise.
Yes.
Okay. So your gag reflex.
Yeah.
Just to improve your
whatever
digestion or motility or something.
I don't know, whatever you said it works on people who got vagus nerve. I thought, okay.
So we'll check your vagus nerve today.
Yeah.
You might not need to do it, but
yeah, I do it.
Okay.
I find that my mood.
Yeah.
My mood and my anxiety. My anxiety generally is the worst when I don't sleep.
Okay.
But recently I've been taking some cortisol and sleeping support, which I sleep very well.
Okay.
And if I have a good night's sleep of like a solid 7 hours, I'm anxiety free.
Okay.
If I wake up in the morning with less sleep, I wake up with anxiety, I try to meditate it and then just kind of live with it.
Okay. And then the gagging helps with your anxiety? Is that why you brought that up?
Yeah.
Okay.
I don't know if it's that or if it's just that's helping something else, which is allowing me to be maybe different. Maybe it affects my mood. Maybe it affects I don't know. I don't feel like I was anxious today because I was a bit conflicted of what had happened. But previous to this, generally, on times that I would be anxious, I'm not. And I'm a lot calmer. Now, I don't know if I could put this all in about gagging.
But the key trigger for you is lack of 7 hours of sleep.
It's usually sleep, or sleep is a problem, and also I have a lot, sometimes my stomach, like if I'm very nervous or feel slightly something, or and it's also emotional based. If I feel like I have to let somebody down, I get anxiety in my stomach, and then everything to do with my anxiety is in my stomach.
Okay.
So like I feel it first in my stomach, and then it's not so much that I can't breathe. I just feel this weird sensation in my stomach, and then the anxiety starts always from my stomach.
Okay. I mean, it's definitely autonomic because gagging is activating your parasympathetics, and if you don't sleep, you just have anxiety, and
right.
If your sympathetics get activated, I mean, your gut motility will stop, your blood flow will stop.
Well, I think gagging has, I gag, there's two things, gagging and I take cold showers.
And they both help.
Yeah, I feel like it wakes me up, it kicks me into gear, I feel like my body's not so cold all the time.
Okay.
And the gagging is like, it's entertaining because everybody hears me because I'm quite a loud gagger.
Right. And there's only so many ways you can powerfully activate your vagus nerve, and that's a very powerful activator.
Oh, yeah.
Okay.
I feel good about it. If there's one thing I do that I feel that I learned from you and watching a lot of your, I really think gagging has been, I don't want to say life-changing, but it has been very good for me.
So a game changer.
A game changer.
Okay.
And just I feel a lot more.
So what would happen if you didn't
gag?
Yeah, do gag reflexes.
I mean, that would be what I was before. Like, I would usually be, like, anxious. I would wake up very tired. Like, even now I may wake up tired, but I go into the shower, I gag in the shower, and I take, so I generally was tired, anxious, very low energy.
Okay.
And very also kind of down.
Okay.
Like, during the time when I did this whole thing,
okay,
it was like I was really down.
All right.
Then I started to go back, watch more of your videos, and start to do some things myself.
Anything else make a difference for anxiety besides gagging and sleep?
Stress.
Well, stress makes it worse, but anything help you?
I'm gonna say meditation, but when I'm doing the meditation, I don't think it's helping. But when I'm finished the meditation, I think it helps. If that makes any sense.
What kind of meditation are you doing?
I do. I just listen. Have an app, and I just listen to a guided meditation.
Guided meditation. Okay.
Yeah, for like maybe anywhere between 5 to 10 minutes in the morning.
Okay.
Before I get out of bed.
Okay. Have you ever done cognitive behavioral therapy for your anxiety?
No.
So anxiety, we got to figure out why you have this pattern.
Yeah, and why does it start in the stomach? Most people's, it's a chest issue. They can't breathe, their heart palpitates. Mine is just stomach related, so I don't understand that.
So ultimately, if you really look at it the most basic level, right? Anxiety means you are activating your fear center, anxiety center of your brain. Something's firing that has to fire for you to perceive anxiety and for the metabolic changes, right? So
Right.
this is an area called the amygdala. The limbic system has to activate.
Right.
Or the limbic system can't be inhibited. One or the other.
Okay. And what about if I was...
Well, let me.
Sorry.
So when that gets activated, you immediately will release catecholamines, epinephrine, norepinephrine, adrenaline, right?
Mm.
And then that adrenaline for many people will cause chest palpitations or heart rate, but they can also completely shut down your gut. So I think it's still the same mechanism. You're just having greater perception of it in your gut. Some people may have a greater perception in their heart.
Mm.
But do you notice your heart rate is up at all or not?
Not as much.
Not as much.
I
Okay.
didn't pay attention to it, but just one thing when you said I did have adrenal depletion.
Yeah.
From my many
Labs.
tests,
Yeah.
labs. So I started to take a cortisol replacement and DHEA.
Yeah, you've been on a lot of hormones.
Yeah, so could that be supporting that to become a little bit better?
No, because the test you're doing is an adrenal cortisol test,
Mm-hmm.
and that's the outer part of the adrenal glands. It's part of the endocrine system, and the type of anxiety you have is neurological.
Okay.
So like the limbic system that we talked about, the fear anxiety center, that activates your adrenal medulla. It's more of a neurological mechanism than an endocrine mechanism.
Okay.
So I don't think it's directly related to your depletion, because some people classify the adrenal glands as kind of like one big thing, and I don't think it's that way for you. All right. Now we're still working through. So like I was saying, the first 3 months, we're probably just gonna have to figure out what things make a difference. The best news is that you know how to control your anxiety. It's strongly related to sleep.
Right.
What that also tells me clinically is your pathways to inhibit your limbic system are what's not working. Because your brain function is totally dependent upon your sleep. So your brain recovery, your brain endurance, your brain fuel, all that's very dependent upon how well you sleep, right? So the first thing that happens when people don't sleep well is they have bad brain function.
Right. And could it be that I for many years I was sleep deprived? Like I had sleep issues for many years?
Yeah, I mean,
could it be?
Yeah, it could be. I don't know, but I just knew, like, for me as a red flag, I'm seeing dramatic change in your ability to have anxiety if your brain is rested, right? And if you don't have rest in your brain, then the whole day's gone. And then the only way you can kind of combat that, which is more likely that the pathways in your brain that inhibit the fear centers don't work or need help, okay, or need activation. Like some people will have anxiety with just motion, movement, restlessness. Well, things that are stimulatory. Yours is very specific to you. Like you wake up with anxiety if you didn't have much sleep. Okay. So that's more of your brain's not able to inhibit that limbic area, and that's actually very specific to the area of the brain called the frontal lobe, which is focused attention concentration. So let me pull up this form here. So one of the forms we had you fill was this brain region localization form, and you do have a lot of frontal lobe symptoms, which is like executive functions, planning, organizing, attention span, staying focused, concentrating. Yeah. Right?
All of it.
So the frontal lobe activates a pathway called the frontal striatal projection. I'm going to write a report for you when we're all done, and I'll have all that in there. You can, if you're not familiar with the terms, you can Google it and all that. But I can also go over it with you. But the frontal striatal projection inhibits the limbic system. So if you have like a frontal lobe, we're going to do some testing, really evaluate your frontal lobe function. But you have all the symptoms of your frontal lobe may not be working as well as it could be. And that is a pathway that inhibits your limbic system. So if you have a frontal lobe that's either degenerating, or maybe you had a past brain injury there, maybe you had a trauma to your brain that you're aware of. I don't remember reading it.
I just had accident. I had a motorcycle accident, but they didn't test my brain.
Did you hit your head?
I flew up and came down. I was unconscious when I hit the
You were
ground.
unconscious?
Yeah.
Okay. It's possible. So you do have a lot of frontal lobe symptoms on your questionnaire form.
Yeah, I noticed that.
And then you also have, which is not good, is you should put number 4, like difficulty producing words verbally when fatigued.
Yeah, when I'm tired, I'm lost for words.
Okay, but you have difficulty producing the words, right? Because there's a difference between being lost finding words and verbally producing the words.
If I'm very tired, it's both.
It's both, okay.
Like I can't, I'm tired, I can't,
okay.
Words are not coming out.
Okay, so those are both frontal, but different areas of the brain. So the Broca's area, this is this question here, when we see this section, Broca's area, you put, find the actual act of speaking, difficult at times. Notice word pronunciation and speaking fluency change at times. You might see by the end of the exam you're not speaking as well. You're extremely tired.
I tend to tire out. Maybe that's... But I work with clients for 8 hours.
Right.
So sometimes I come home and I can't even talk to you.
Okay, so that's a big sign. It's frontal, and your frontal pathways inhibit your limbic system, and if you're it's more than likely that's why you have anxiety.
Okay.
From that, but we'll see what's there. You also have, which I really did not like, all these early. These are all early Alzheimer's symptoms. Category 4, medial temporal lobe.
Mm-hmm.
This is actually identical to the symptoms of the American Alzheimer's Disease Association for early Alzheimer's. So memory less efficient, you put 4, which means 100% of the time. Like you're always having memory issues. Is that right?
I have bad memory.
Okay, but it's
getting better with gagging.
It is getting better with gagging?
Yes.
Okay.
I was impressed.
Getting well. In what period has it been getting, besides gagging, was it getting worse before gagging? How fast was it going?
I don't think it has gotten worse. I think I've had a bad memory.
Your whole life?
A lot, like all my life.
Okay.
Like names?
Yeah, always. Okay.
I could talk to him for like 5 hours and then he'll leave and I won't remember his name.
Right.
So.
Well, some of these things are just the way you have learned to function. But what we're most concerned about is new symptoms.
Right. Well,
So would you say your memory, like remembering events, remembering locations, addresses?
No, it has been for a long time. I remember even when I was young, friends would remember times together, and I wouldn't remember being there.
Okay.
I mean, probably it's gotten worse but it's not been, I haven't noticed because I've always had it pretty bad. So I don't know if...
All right. So we'll have to see what's there. I mean, well, at the end of the day, since you have such a strong risk factor for Parkinson's in your family tree, we're gonna have to, once like we get rid of all your symptoms,
we're gonna have to
go, hey, you need to be on a brain prevention protocol because of your risk, and then we'll kind of fine tune things for that.
Yeah, and I think that's important for me.
Yeah, absolutely important for you. Okay. So there's also some issues here with the area of the brain that you had a lot of symptoms for with balance.
Yes, my balance, especially on one side, is very bad.
What side?
Left.
And when did that start?
From the time I've been exercising with my trainer.
How long has that been?
Probably like from my 20s.
So over 20 years? Is it getting worse over time?
No, it's just awful.
And it's not been getting better with 20 years of exercise?
My balance is really bad on one side.
Okay. So we'll have to figure out why. So we'll have to do a really thorough evaluation.
I feel like, I'm going to leave it at that.
But it's not only balance, because you also put a rating of 4 out of 4, recent clumsiness and hands. Is that the same side of your balance?
Clumsiness and hands? I find that sometimes I break things. Like they're in my hand, or I put in my drop them, I do this.
Okay. You also put down crowded places cause anxiety.
Sometimes, yeah. No, all the time.
All the time. So that's different.
If you take me to a shopping mall.
Well, that's what I was trying to ask you with anxiety. Like, is there anything that triggers it?
Oh, sorry.
So movement, lots of things.
Like if there's just too many people in some place, I don't feel comfortable.
Okay. All right. So we have lack of sleep and we have stimulation.
Yeah, but I just need out of that. It's a different feeling. Like I don't feel the same anxiousness as I feel in the mornings sometimes when I wake up and have that. The feeling that I get when I'm overcrowded is that I gotta get out. I gotta get.
That's different. Sure. Okay. All right. Let's talk about. I mean, you're on hormones. Why are you on all these hormones?
Because that's what they told me to do. I don't know. My functional medicine doctor had said, I started to have suffering with sweating.
Yeah.
And then we went through like natural way with like supplements, Estrovera, this, that, lots of. I had reprieve.
Yeah.
And like 6 weeks later, it came back again.
Okay.
So then I.
But you're taking bias, testosterone, compound progesterone, and DHA now, right?
Yeah.
And you have hot flashes, irritability, like a patient's.
Now the irritability is gone because we fine-tuned it in the last several months.
Okay.
I don't feel as irritable. She increased my DHEA.
Okay.
So now I take 4 drops in the morning and 4 drops at night. It stopped my daytime feeling warm.
Okay.
But my evening is
so you're 47 before you did your hormone replacement protocol. Were you having any changes in your menstrual cycle?
Yes.
Perimenopausal?
Mm-hmm.
Did they measure FSH and LH to see if you were perimenopausal?
I think so.
A
long time ago.
Okay.
Like a long time ago is just when I was thinking about having a second child.
Okay. They wanted you to do hormones before you got pregnant?
No. They tested me to see if I was premenopausal or.
And you weren't, or you were?
I was starting to get,
Okay.
There was low eggs and all of that.
Okay.
It started quite early, like at my 40, 44.
So you're in perimenopause at 44, probably.
And now probably full menopause.
Okay. You have some symptoms of blood sugar instability, like blood sugar's not stable all the time, energy level fluctuations, energy levels drop in the afternoon.
Mm-hmm.
You feel energized after you eat. You said
Yeah.
2. Those are all signs of like your blood sugar being low.
Mm-hmm.
So let's go through your average day. Tell me what you're eating and what time in a timeline fashion.
So I fast.
You fast.
So I fast Monday to Friday for 16 hours to 17 hours, sometimes 18.
So like time restricted, you're feeding 16 to 18
Then I
hours.
break my fast with my first meal, which usually is anywhere between 12 o'clock and 2 o'clock,
Okay.
depending on how long I'm fasting.
Okay.
And it's pretty standard.
Okay.
Like lightly steamed greens,
Okay.
a protein. It
Okay.
could be egg, it could be chicken sausage, it could be like some kind of a protein. And then some nuts,
Okay.
cucumbers, tomatoes, lots of greens. I steam a lot of greens, and then just some oil and vinegar.
Okay. So that's 12 to 2.
Mm-hmm.
And then when's the next time?
Probably shortly after that, like 2 hours later,
Okay.
I'll be hungry again.
What do you have?
Depends what I have with me at work. It could be like almond butter and apple.
Okay.
I could have a handful of nuts.
Okay.
I could have baked something the night before that I brought to work. I may have that with a little tea.
Okay.
And that's it.
And then after that?
It's dinner.
Dinner. And what's dinner?
Dinner's like generally like a protein. Like some nights it's a protein, vegetables,
Okay.
like fish, greens and sweet potatoes. Some nights it's pasta. Some nights it's
Gluten-free pasta, right?
yeah, gluten-free pasta. And some nights it's like steak. Some nights it's
Okay.
chicken.
So mostly like vegetables.
But I do have to tell you, I don't work
Meats.
well on that.
You don't do well with dinner, or you don't do
No,
well
I
with
don't
fasting?
do well with fasting. I'm starting to realize that I cannot, when I eat so much in a short amount of time, I think it affects my stomach.
Okay. Did you start the fasting for neuroprotective reasons, or why did you start fasting? Is it for weight loss? Or
No, just for health.
just for health?
For better health. And they said it would help with my hormones.
Yeah, I mean, it definitely has a lot of benefits. And
None of it, I mean, it didn't help my hormones.
instead of doing a 16-hour feeding window, have you thought of just doing it like an 18-hour?
So fasting for 14 hours and eating for 18 hours?
Yeah, for 8, for 10, or
Yeah, I find those 2 big meals,
yeah.
even though I'm hungry and I sit down and eat them, I feel like I've gained weight doing this.
Have you actually gained weight though?
Yes, I have.
You have gained weight even though you're doing a fast like this
Yes.
with these limited calorie foods.
Yeah, but they're robust. Like my
Yeah.
salad is robust.
Huge steak salad. Okay.
No, it's not a huge, it's a 4-ounce steak, but my salad is lots of greens and
Okay.
you know, this and alpha this and I don't know. I feel like my stomach does well.
Okay.
Like when I have like breakfast and I eat like something in the morning and then I don't eat lunch and I eat dinner. I feel like the bigger window between eating for me is better. Okay, obviously from breakfast to dinner I probably have an apple, I may have some bone broth, you know, I may have something, but I don't know. This is what I've sensed. Maybe just my breakfast portion is.
And how long have you been doing this for?
Probably like I don't know, maybe 3 years.
3 years. Maybe.
COVID just puts this.
Maybe you need a break.
Yeah, I'm starting to feel like I'm needing a break because it's not working, and I find like I'm perpetually heavy feeling.
And it's possible it may be aggravating your anxiety. So we'll have to see. So we can't do too many things all at once because then like we won't know what's happening.
Right.
But we have to come back to this and experiment. Every now and then you should break things up anyways. Like 3 years straight of doing time restricted feeding with anxiety and symptoms of hypoglycemia and you having an instinct that maybe it's not the best thing for you, you know, it's good to do these like periodically, even in the future, because it has neuroprotective benefits.
People say that you should be keep like this all the time for the rest of your life. Is this right or no?
Well, it might be for some people.
Some people.
And then for others it may not be, and maybe a 16-hour fasting window is too much. So maybe do a 14-hour fasting window.
Okay.
Maybe your symptoms.
Maybe do it only once or twice a week versus every day.
Yeah, there's different ways you can do it.
Okay.
But we'll have to experiment with this.
I'll experiment with it too.
But don't do anything yet, because we're gonna set up a plan.
Okay.
So if you start doing things on your own, and we have like a plan.
I did break up my intermittent fasting the last few days, like from Monday, just the past few days, just because I was kind of felt like, but I can go back to it.
Did it help you? Did you notice the difference?
Yeah.
What did you notice?
I felt like I wasn't so full, and I didn't want to eat so much. I feel like sometimes when I fast for a long time, I'm very hungry, and I just want to eat.
Yeah.
And I just take this huge amount of food in the beginning. And it maybe to most people, they laugh that work with me. They look at my food, they're like, oh my God, like this is nothing. It's like bird food.
Right.
But it's still calories. Like I cook up collard greens. I mean, I have kale, I have this, I have that, I have eggs, I have nuts, I have seeds, I have...
Well, basically your first meal is greens, protein, some kind of protein, like a few ounces of protein.
Yeah.
And tomatoes, olive oil. So it's like salad.
Yeah.
Salad with a little protein.
Yeah, and I started cooking my greens because I felt like the roughage may have been causing me to be bloated.
Did that make a difference for you?
Yeah, everything makes like a little bit of a difference, but nothing's like life-changing.
Okay. All right. What about the last major symptom you have is lack of joy?
Yeah, that tends to be better now.
Okay, good.
So that I don't want...
What do you think made a difference for that?
2 things.
Okay.
My call with you.
Okay.
And...
So remind me, because before you came in, we had a talk and go, hey...
Yeah, you said, you know what? Like, stop this feeling sorry for yourself. And I was like...
Well, we already have a friendship before.
No, of course. And I take it and I took it... I was like... First I was like, why is he saying that?
Why is he such a jerk?
No, I didn't say that. But I was like, why is he saying that? And then I kind of took it back, talked to my husband, and I'm like, and he's really awesome in the way that he's never judgmental. And he said to me, well, think about it. And then I thought about it, and I was like, yeah, I do feel sorry for myself because this happened, that happened, that happened, that happened. And I was like, okay, well, let it go. And I just, as quickly as you said it, and as quickly I processed it, I kind of let it go.
Good.
And also, I know you're going to laugh, gagging.
I don't know.
No, I'm telling you, if you don't gag, you should gag. It's really, I don't know, it was good for me.
That's right.
I don't know. I mean, I'm pinpointing it maybe to all one thing, but I feel like it's changed my mood.
Okay. When you meditate, do you spend some time to appreciate things?
I'm starting to, Dr. K. You know,
That's a good time. It's a good habit.
It's a long journey for me, and you know, I'm finally, after many years, coming to just recognize myself as somebody versus just everybody else is somebody. So it's been a long journey to get here, and
But a consciousness of like some gratitude.
Yeah.
Are you
always.
But after meditation, are you doing that?
No.
Because that's another practice. A lot of people that meditate have a lot of benefit from.
So maybe I'll do that. Do a little writing in the morning. Things I'm thankful for.
Yeah.
Mm-hmm. I have all the journals ready. Thought about it, and I just have to put pen to paper.
You know, usually for myself, I can tell you I do that every day.
Yeah.
The days I don't, it makes a big difference. And the days I do, because you know you can always find things that are bad. Sometimes it's easier to think about all things that are bad than sometimes think about things that are good, and then that makes a big difference, especially when you have a lot of things on your plate to deal with.
And it's so funny. I'm the biggest proponent. I advertise it like I wear the badge. Yeah. So I have to start focusing a little bit. Like, you have to be so thankful. You know, look at the blessings you have.
Right.
I have to kind of sometimes.
Okay. Put that in there. Talk to me about you said you work out with a trainer in physical activity. Tell me about that.
So I'm a big I exercise. It's very important for my anxiety,
okay,
and for my mood. None of it is for my actual physical appearance. I don't.
This is for your mood.
Especially I started to work out tremendous, like religiously, 5-6 days a week, because I was waking up for probably 4 years of my life with anxiety every morning because I was so sleep deprived. So when I was up at 5:30, the best thing to do was to go to the gym.
Okay.
So I used to just get up, go to the gym, work out, and I worked out on my own.
Okay.
Just recently I decided to get a trainer, which my husband and I split him 30 minutes and 30 minutes. So just to kind of get a little bit, I have a lot of injuries in my back because of car accidents. So I just want to tweak up some things because I hurt my knees recently from overrunning.
So what's an average week for you? So you wake up in the morning.
Yeah.
How many days a week do you work out?
I used to be a lot better. Now it's about 4 days.
4 days, and so it's aerobic, anaerobic. It's weight training.
A lot of weight training now.
Weight training now. Okay. And the days you don't work out, the 3 days you don't work out, you walk. And is there a difference between walking versus weight training on your anxiety?
I love walking because it's also very therapeutic. So I find that if I could go for like a 1 hour walk, I feel wonderful.
You feel fine.
But in life, I don't have 1 hour of time, and now Canada is damn cold, so going for a 1 hour walk is not so exciting. So I would say they both kind of give me the same result, which is I feel, the best way to explain it to you is I feel like I got rid of all the gunk.
Right. So if you didn't sleep and didn't get a chance to work out, you'd be a mess?
Yeah.
You'd just be nervous all day? Anxiety all day?
I would have, until I go to work. When I go to work, my focus changes to work, and I become work mode. And when I'm in work mode, I don't have anxiety.
Right, because you're so focused and concentrated.
Yeah,
okay.
Concentrated.
So this all sounds like frontal lobe. Because you're at work, you have attention, focus, concentration, you're planning, you're organizing, you're doing your things, so your frontal lobe's healthy.
You would never know at my day that my night or my morning could be that. People think I'm like
super
invincible.
Yeah.
And I'm like, oh God, no, I'm not. Come to my house for a few days.
Right. That's good. You're in it, and you're ready to go.
Very driven, very motivated. I work. I never call in sick. Like I never want to not go to work. In that way, I'm very good.
Okay.
Probably COVID made things a little worse because for 8 months my business was shut down. So.
Okay. And the stuff you're doing in business is
design.
Executive functions, right?
Yeah, I design, but I also run a business. I run the day-to-day operations.
So lots of planning, organizing.
Yeah, like I have like 25 people that work underneath me, so I'm making sure.
Whole team. Yeah.
Whole team and.
Okay. All right. I think I've got a pretty good idea of what's happening.
Okay.
But we don't know for sure. We'll have to check a bunch of things. There's definitely a brain component to a lot of your symptoms. And let me ask you another question. The days you have anxiety, is your gastrointestinal symptoms worse?
I've never thought about that.
What do you think?
I don't know. I can't give you an answer on that. I knew you, through this I kind of thought of that too.
Yeah.
And I was like, I should think about that. Maybe. I don't know.
You don't know. Okay. And again, you have made more than one thing that's there.
Yeah.
So it seems like you may have like a food sensitivity, most likely dairy. You may have early motility issues. It's possible your frontal lobe is not engaged. That's why you have chronic anxiety. That's why you have to constantly sleep, have proper sleep, and have to exercise or activate your brain, focus, attention, concentration, is all frontal lobe. So we really want to take a look at that. The dizziness is something that we got to figure out what's happening. So you have that, or not dizziness, but balance issues. Figure out why your balance is bad on that, especially if it's only one side balance issues.
Right.
Go from there. Okay. So what would be the ideal outcome?
I would be no stomach problems. I could go to the bathroom without traveling with a whole load of things.
Okay.
And I would be anxiety free. My hormones we didn't discuss a lot, but when I talked to you over the phone, you said, get off them. I'm like, oh God.
No, I didn't say that.
You said you may want to get off them. I was like, maybe all of these are affecting. That's what you said. Maybe all of this is affecting, but.
Well, it seems like, well, to be totally honest with you, it just seems like the way that your labs were interpreted and the way you were just placed on stuff was so random. And then there was an amino acid model for hormones, which didn't make any sense to me. So,
and this is like one of the better doctors.
Right. I mean, you've seen talented people. That's not the problem.
No, but maybe if you know another person that's talented, that could take care of that part of it, because I'm very conflicted about that.
You are? Okay. We'll have to work through that.
Yeah.
Right?
Okay.
It's not the first layer.
Let's first deal with it.
And then if you go off everything right now, it's gonna.
Oh my God.
It's gonna be a problem.
Yeah.
So we'll have to kind of work away. Any questions for me?
No.
Okay.
No. Not right now.